Hello, welcome to phase 1 of ACL recovery program. So this phase 1 usually starts in immediate post-op period and it expands up to the end of second week. It includes the part which is in immediate post-op period. So there are few concerns and few things which you should be aware of, and I will be talking about same. Most of the ACL surgeries are done under spinal anesthesia, the action of which usually ends by 6 hours after the surgery. After the 6 hours, you will start getting some pain, which is usually controlled with routine painkiller medications. The second thing is about the drains. In some cases, we use small pipes which are put inside the joint to drain out excessive blood. So this usually depends on the duration of surgery, what all procedures are done inside the surgery. For routine ACL surgeries, we don't use drains nowadays. And if there is some multiple ligament injuries and cartilage treatments, or we expect some bleeding to occur, then we prefer to put a drain pipe, which are usually removed after 48 hours of surgery. In immediate post-op period, we usually use braces. These are called as long knee braces. So these are the belts of which extend from mid leg up to the mid thigh level. They are used to immobilize your knee. In some cases, they may apply a plaster of Paris. Usually, we prefer a belt or flexible braces which are like with limited motion also. So they can be used in immediate post-op period and can be continued up to initial 1 month after the surgery. Clinical considerations in immediate post-op period. The first is about pain. As I told you, you will not have much of pain in initial 5 to 6 hours after the surgery, but afterwards you might start feeling some pain, which can be easily controlled with some painkiller medications. There will be some amount of pain for initial 2 to 3 days. After that, the pain intensity is usually very less and it can be easily controlled with the help of some medications. The second consideration is about the swelling. We usually expect some kind of swelling in the distal part of the leg or in the knee, and it's about like minimum to moderate. There should be not much of swelling. The third is about redness. Some redness is expected and is usually a response to injury. Next consideration is about fever. You may have a fever, an episode of fever in the second post-op period, which is usually due to a response to injury, and you need not worry about it much. However, there are few red flag signs which you should be aware of, should be taken very seriously. These are the combination of all these things. So even after initial 2 to 3 days, you have severe pain, you're not able to bend your knee, and you are having increased in swelling with local rise of temperature, with fever and chills, then definitely these are the red signs and you have to take them seriously. You need to consult your doctor immediately. You have to rule out infection in such cases.